I'm Dr. Felix Bongomin. I'm a medical doctor here, based here in Uganda, and I have interest in fungal diseases, and I also work as the ambassador of the Global Action Fund for Fungal Infection here in Uganda. So today we are going to talk about Tinea capitis. So Tinea capitis is commonly referred to as ringworm, and this particular ringworm involves the air and the skin of the scalp, and it is a very common infection that occurs mainly in children aged between 5 and 15, but also there are some who may be above the age of 15 or also less than the age of 5. So Tinea capitis is really known to be an endemic and highly neglected tropical disease in most African countries. Though some authorities say it is a common disease, but the real burden is not clearly described. So in this paper that we have just recently published, we looked at the burden, we quantified the cause as well of Tinea capitis in Africa. So in this study, we looked at about 40 papers published between 1990 and 2020. So in this paper, these 40 papers were published in 17 of the 54 countries in Africa. And in this paper, we were able to demonstrate that the pool prevalence of Tinea capitis is about 23%. And 23% translates into up to 138 million cases of Tinea capitis occurring among school-age children in Africa, given that the population of children in Africa is actually very high, in fact, as high as 600 million. So why is Tinea capitis a big problem in Africa? There are several reasons. One, I've already talked about the many children that we have, but that shouldn't have been a big problem. The bigger problem is because of poverty, which makes overcrowding, and then, of course, sometimes sharing of housing between animals and children, and that leads into a transmission of this disease, because we know the agents that cause Tinea capitis can be transmitted from either humans to humans or from animals to humans, and very rarely soil to humans. And so, and also we have a growing number of actually refugees in many African countries, and that congregate kind of settings promotes transmission of the causative agents of Tinea capitis. And yet, actually, if you look critically, the diagnosis and treatment of Tinea capitis should actually be is very simple and straightforward. But why are these patients underdiagnosed? One is that the disease in itself is not painful. So patients often do not go to healthcare facilities to seek for help. And so we don't get a proper diagnosis. And even when they go to the hospitals, most hospitals either do not have access to the appropriate diagnostic tools, and that still augments the underreporting, or even when it is properly diagnosed, still we do not have access to the treatment for Tinea capitis that would typically it is either griseofulvin or terbinafine, or even in some circumstances where these agents are available, most patients cannot afford because of the cost that are associated with these diseases. And also given that actually many countries do not have a drug, for example, like terbinafine on their essential medicine list. So there are some immediate needs that we actually call for, especially public health interventions to, one, improve the diagnosis of Tinea capitis and direct appropriate therapy through community sensitization about the signs and symptoms of this disease. And then we also have to advocate for improved access to diagnostics and also improve access to essential medicine which can be used for treatment of tinea capitis in our settings. So by and large, we know tinea capitis is as common as most of the infectious or other non-infectious diseases that we have here in Africa, because a condition which affects 1 in every 5 children is really a very common a childhood disease that requires public health intervention. Thank you.